this lesson, we are going to be talking about scoliosis. It's a pretty straightforward diagnosis, so we should be able to cover it pretty quickly. Scoliosis is diagnosed when there is abnormal curving and rotating of the thoracic spine. So just as a refresher, at the top you have your cervical spine. Here you have your thoracic spine, which is what we're talking about for scoliosis. And then at the bottom you have your lumbar spine. Scoliosis is usually diagnosed during the adolescent growth spurt. So for girls, this is between 10 and 12 years of age, and for boys, it's usually between 13 and 14 years. When it's diagnosed, it's going to be measured in degrees. So you can have a mild case of scoliosis, which is going to be 10 to 25 degrees. You can have moderate, which is 26 to 45. And then a severe case of scoliosis is going to be when the curvature is greater than 45 degrees. When you are doing an assessment for scoliosis, the first thing to know is that you've got to have that patient take their shirt off. And this is so that you can actually see their entire back. You need to see their shoulders, their back, all the way down their spine to the tops of their hips. And you're also going to want to assess the spine in two different positions. So the first position is going to be like this here, just to have them simply stand in front of you with their arms down beside them. And the second position, you're going to have them again stand in front of you facing away, but then you're going to have them bend over with their torso sort of parallel to the floor and their arms hanging down. And pretty much what you're looking for in both positions is asymmetry. So you're looking for things to not be even on both sides. So just as an example, you want to look and see, do the shoulders line up, or is one side higher than the other? Are the scapulas even on both sides, or is one higher than the other? And so on down, because you can see it with the hips as well. And then when you're looking in the second position, you're really looking to see if the ribs are uneven. So again, you can see quite easily here how there's an unevenness to the back. And the right side is actually more commonly affected than the left. Now, scoliosis is often associated with some other diagnoses like spina bifida and Marfan syndrome. So you want to just check for any kind of spinal anomalies. You want to check reflexes, look at their bowel and bladder habits. Is there any kind of dimpling or hairy patch on their back? And just looking for signs of other syndromes. And then the last thing you want to think about are some of the things that can actually be problematic for kids who have more severe cases of scoliosis. If the twisting of their spine is bad enough, it can actually affect their pulmonary function because their lungs aren't able to expand properly, and this results in frequent respiratory infections. And then the other thing that can actually happen if it's severe enough is that it affects their gait. You can imagine if your hips are that uneven, you may actually have a limp because of your scoliosis. So the management's going to be completely based on the severity of the scoliosis. And so just if it's only a moderate scoliosis, they're probably just going to have to wear a brace. And if it's mild, they may not need any treatment at all. So for the moderate scoliosis, they're going to wear a brace, and you can see it in the photo here. It's a huge brace and it can be uncomfortable. So you can imagine that compliance is an issue, especially because they have to wear it for 23 hours a day. So you really want to make sure that you're working with these families to make sure that they are compliant. And then also it's really important to be monitoring their skin underneath that brace. Surgery is going to be indicated for patients who have a severe scoliosis, which remember is greater than 45 degrees. And this is a very massive surgery. These patients are often going to be admitted to hospital for 5 to 7 days, and they're having pins and rods inserted into their spine to help straighten it. The first thing you want to think about for your post-op care for these kids is pain. It can be a really painful procedure, so most of them are going to be prescribed PCA pumps. So it's really important to educate these kids on how to use these to properly manage their pain. Physical therapy is going to be really involved with these cases, helping them ambulate and get moving in a safe way. And until otherwise notified by the provider, it's very important that when you're moving these kids that you use a log rolling technique to help protect that spine. Now, like I said, it's a pretty massive surgery so there are some complications that you want to be on the lookout for. The first thing is spinal cord injury. Okay, so they're in there, they're doing surgery on the spine. So sometimes damage can happen to those nerves. So you want to be looking for things like paralysis and bowel and bladder incontinence. Spinal surgeries also tend to sort of lose a lot of blood. So you want to make sure you look out for signs for hypovolemia, and then also to see if there's any sign of hemorrhage post-op. When you are providing nursing care to a kid with scoliosis, your priority nursing concepts are going to be mobility and comfort. Okay, so let's do a recap of your key points for this lesson. So first thing to know is scoliosis is when there's curvature and twisting of the thoracic spine. It varies in terms of severity, so you can have less than 25, which is mild, and they may not need any treatment at all, or you can have greater than 45 degrees curvature, which means they're probably going to need surgery. When you are doing your assessment regarding scoliosis, you want to look for asymmetry on that back. So you're looking at shoulders, scapula, ribs, and hips as well. Moderate scoliosis, which again is 26 to 45 degrees, is going to be treated with bracing. Remember, compliance is a big deal because they've got to wear this brace for 23 hours a day. Severe cases of scoliosis are going to need to have surgery, and this is where pins and rods are placed in the spine to straighten it. And remember, it's a pretty big surgery. So for our post-op care, the number one thing we're looking at is going to be pain control, and then the mobility, where we're protecting that spine by doing log rolls and involving physical therapy in that care. You've also got to be on the lookout for complications like spinal cord injury and then bleeding from the surgery. And that is it for our lesson on scoliosis. Make sure you check out all the resources that we have attached to this lesson. We've got some great pictures there. Now go out and be your very best self today, you guys, and happy nursing.